Hi, my name is Sean, and I'm a fellow student at the FSCJ BSM program. And in the community nursing class, I am doing my presentation on nurses in correctional facilities. Let's get started. Educational preparation. What do you need to work in these places? You don't need anything really. You just need basic licensure. You don't need any type of certification in wound care or IV or anything of that nature. You just need to be an RN. They take LPNs as well. You don't need your bachelor degree, although obviously higher education will always be preferred. And then it's clearly going to be recommended that you have been a nurse for quite some time. At least a year is usually what they recommend in med surg, but you don't want any new nurses coming into these environments. And obviously, I'm going to talk more, why that is, the different atmospheres and things of that nature. You want someone that's strong in their nursing background, that they have, not just good in the skills, but good in their judgment. And that only comes in time, unfortunately. And it also comes in a better environment. Obviously, a hospital is going to be much preferred than a prison. Scope of practice, what are you doing? So the med pass that we're all familiar with, especially from the hospital giving out medications, you're going to be responsible for these patients' over-the-counter prescriptions, even if it's just Tylenol, and then the regular prescriptions. If you have someone that's brought into the facility and they've been on certain medications all their life, you're going to be responsible for them, because clearly no inmate just has medications in their cell. So you're going to be responsible, and that responsibility comes in the same sense of nothing new, knowing your interactions, knowing what medications you're providing these patients, and then advocacy. Obviously, advocacy is something that we always talk about in nursing, and in all the different aspects. And I'll talk a little more about why advocacy specifically matters here. And but part of it to speak about it now would be that not all of these prisons just have full-blown hospitals inside of them, obviously. So if a patient needs something, it's up to you to let the higher ups know, that they need this. And I'm not just talking about going to a doctor, but they could be the people that run these places. You need to convince them that, hey, this man, needs X, and we don't have that here, and we need to get it. And that costs money. Psych nursing definitely plays a role in the sense of, conversations, how you're talking with these people, learning their psychology. Each individual is obviously going to be different, and especially in this environment, this environment will change them. This environment isn't going to be the greatest environment you want them in, and they're going to want to talk to you. And I'll talk a little more about why that is important, and these patients aren't sick necessarily. But I would, psych nursing definitely does play a part in what you're doing for these patients. They're similar. And then other medical staff you'll be dealing with, obviously doctors will be there, nurse practitioners, a lot of nurse practitioners in these correctional institutions. Not quite as many physician assistants, but then you'll have LPNs as well. But you're not going to see any of your physical therapists. You're not going to see your occupational therapists, respiratory therapists, which is where the advocacy comes in if a patient needs something, and they try to get a hold of, what's needed. Obviously, no type of speech therapy. So just really, what can be provided in like a little, like a little clinic. That's what's going on here. Skills and abilities. So related to like what's in a small clinic, routine and emergency care. As I said, you'll be managing their medications. You'll be managing their diseases on a routine level. Emergency is going to be if someone codes. Emergency is going to be more likely if someone's choking and you have to do the Heimlich maneuver. Or maybe someone's been, heaven forbid, slashed or stabbed in some way, which does happen, and you've got to stop the bleeding. And then obviously that goes in the same hand in hand with chronic and acute illnesses. Maybe someone has now been brought to this facility that's had cystic fibrosis all his life, or some type of, or maybe chronic pancreatitis, and so they're going to need, help over time. Chronic management, or acute illness could be maybe this man is now, suffering from appendicitis, and you've got to make that call, that assessment, and get them to where they need to be, because obviously that requires surgery, and no surgery can be performed in these prisons. Disease prevention, I'd probably say, is number one out of all of this, and what the role of what the nurse does in this type of facility, because it's a prison. It's not clean. You're going to want to make sure that they wash their hands with soap and water appropriately. Use hand sanitizer. No matter as much cleaning as you do, these places are nasty. And And this is communal living. Obviously, it's forced communal living, but this is where you're going to see small outbreaks of maybe the flu going around, tuberculosis. That's something that we don't often deal with. I don't deal with outbreaks of tuberculosis on a regular manner. And so you're going to, get these people vaccinated for whatever vaccines they need. Keep tetanus shots probably up to date. If they get stabbed with something, as I mentioned, in emergency care, it's probably not going to be the best piece of thing to stab somebody with. Could be rusty. And so a lot of disease prevention is going to be important to keep your patients safe, if you will. Teaching strategies, demographics. Demographics is very important. That's why I typed it out 3 times. If you're in states such as something like Florida, Southern Florida specifically, Texas, those are like those states that border Mexico. You're going to want a lot of basically states where there's a lot of Spanish speaking people. You're going to want Spanish speaking materials. You want something that gets on their level. And you have that's probably your foundation. Obviously, you want to know your demographic. You want to know what's the mean or median, education range in these facilities, so that when you go to do your disease prevention, who are you talking to? What are you trying to convey to them? You want them to feel it on a personal level. You want it to be easy to understand. You want to hit as many people, in that scope as much as you can. And that's where the therapeutic communication comes in. And it's nothing new. If you've got a stubborn person, you don't want to tell them what to do. You give them their options, and you lay out what the best options are, and hopefully they take them. And you maybe try to give them incentives, or try to tell them, listen, I know you don't want to go down this route, but if you do, it's going to be much better for you. Or the route maybe they want, explain to them, listen, this is going to be much more difficult. And then you have some that need to be kind of pushed. Maybe they do need that force in their life, and you kind of make that decision for them. And they need help in that regard. So you have to be careful about just who you're talking to and what you're trying to say. Difficulties, obviously, the number one most difficult part of this is that you're in a prison. This is your environment. You're going to feel your environment, your work environment. That is, if you're in a prison, no prison is going to be nice. It's still a prison. Obviously there are prisons that don't have as much gang activity or violence as others do. And that's a benefit, but you might be in one that is, and you have to deal with that atmosphere. You're going to feel it. Your stress level may rise. Even simple things such as pens and pencils could be behind lock and key. And dealing with that type of environment on a daily basis, can be very stressful. Um, how you care for these patients is going to be a small clinic environment. Obviously, it's not in a nice, big, fancy hospital. Um, and so, guess what? So, not a lot of nurses choose prison nursing as their number one choice. So, there's a lot of shortages. In 2015, Barack Obama said that across the nation, there's 116,000 nursing jobs that are still open, and that's the entire health system, which does include the prison system. And so you've got short-staffed working. So you're in a tough environment, you're short-staffed. Maybe you get 1 or 2 people, but you're still at that short-staff level. So guess what? They leave, and then the cycle continues. And so that's going to be a constant battle, is just trying to stay adequately staffed. And it's crazy to think that we don't ever deal with this type of topic in relation to the environment, like I was saying, advocacy, shortages, but it all comes back to funding. When we work in these hospitals, we don't work with, the mentality of like, I hope I can do my job today. I hope we have enough money to, I can start an IV, and that mentality. But, maybe in relation to disease prevention, maybe you've set up a presentation, such as this that you want to talk about. And you got your nice projector, you give them the presentation, and next year you think, oh, I want to talk about this next topic. Well, guess what? Your budget has been cut, your area, and you no longer have that projector, and you're good. Excuse me. You're going to kind of feel hurt. You're going to kind of feel like, you're going to want to take it personal because you're trying to do your job and they're not helping you do your job. And so that plays a part in advocacy, like just trying to convey to those people that are housing these inmates, like, we need to make a decision. They need to go here, but that costs money. Environment is going to be, all related to funding. The shortage, which is, are they able to pay these nurses? And this is both a problem in the private and public prisons. And that's definitely the most challenging, I feel like. Right behind environment would be funding, because that's not just not something we're akin to dealing with. Nurses, we're used to dealing with tough environments. An ER is an ER, or no matter where you are. And but in that regard, you don't ever worry about, man, I hope I have the funding to do my job, which I think is just a unique mentality. And speaking of uniqueness, I would say after all of this, the things that jumped out to me was that not that these patients are misunderstood necessarily, but the whole representation. I've never been in a prison, and I hope many of you have not either. Whether having to be locked up or visiting a relative. But so where do we get our ideas of what prison is like? Obviously, it's secondhand. It could be news, it could be movies, and movies are dramatized, for the entertainment. So the only, mental ideas that I have are from vastly, probably out of proportional stories and entertainment. And no one can tell you what a prison is like except a prison nurse, and that's just how it is. No one can tell you what it's like working in the ICU except an ICU nurse. No one can tell you what home care is like except a home care nurse. No one can tell you about hospice except a hospice nurse. So this kind of falls into that same sort of mentality that we probably have a lot of preconceived notions, and they aren't that way. We always hear stories of people saying, "Oh, that murderer was the nicest person I ever met." And but we don't often think that of like that of all these prisoners. But they're gonna they need you, so they're gonna probably still be respectful to you, hopefully, and nice to the people there that's taking care of them. And so you really have to, put away your preconceived notions. You have to put away, what you already kind of judge, if you will, this type of environment to be. And like I said earlier, these people aren't sick. The reason why I found this to be unique was that in all of nursing care, there's only one other type of um, department, if you will, that's similar to this, and that would be OBGYN. Those patients, they're there to have a baby. They're not sick. They are in gowns and they are in the bed, and then they have to deal with the fall alarm like everyone else do. Maybe they're getting IV fluids, but obviously, but being pregnant is not a disease. And so these patients don't come there to be cared for. They're not in patient gowns. They're not in beds. They're not getting IV fluids. You're not going from room to room bringing them water. They're there for other reasons, and then you're there in case something happens. So it's kind of the reverse of, like, rather than in the hospital, they come to you. In the prison, you go to them. And that's what I found to be pretty interesting in that aspect. It's just, we've never done that before. I've never had to deal with that in that type of role. So anyways, that's my presentation for nurses in correctional facilities, and I hope you enjoyed it.